Ladies and gentlemen, the author of the bestseller Living to 120 is with us, Adriano Panzironi.
Good evening everyone.
Welcome back, Adriano Panzironi. I see you smiling and charged for a very interesting episode.
Oh yes, tonight we are going to find out the truth about one of the diseases that official medicine cannot cure, namely migraine.
And so I would say let's send this introductory video.
Headache, in its innumerable expressions, occasionally involves 5 out of 7 people, while 3 to 5% of the population suffers from chronic migraine. There are also less common forms of headache, such as cluster headache, which involves only 0.1% of the population, but its severity has also made it renamed as the suicide headache. Overall, the disease of migraines costs, in terms of public spending, a record €27 billion a year in Europe alone. In Italy, about 3 million people suffer from chronic migraine, with a loss of 12 million working days and a social cost of €6 billion per year. It is also estimated that 4 million doctor visits are made each year in Italy just because of migraines.
Panzironi, then headaches are a condition that virtually the entire population is concerned about.
Consider that only 10% of the population can claim to have never suffered from a migraine or headache. 70 to 90% suffer from it at least once or more a year. Even 10% of the population suffers chronically.
The introductory video mentioned 4 million visits each year to the doctor just to try to treat headaches.
Surely we can say that headache is one of those conditions that is worst dealt with by our medical class, which as usual, let's say, worries about the effects. So he tries to administer medications that can reduce the effect of the pain. Actually, we know that the headache is simply an alarm bell that is telling us that we have an alteration in the microcirculation of the brain, and that this will be able to lead in people who suffer from it at a young age, in old age, to major problems such as Alzheimer's, such as dementia, such as precisely stroke problems.
Look, though, Mr. Panzironi, I immediately need a curiosity that you have to solve for me, because if headache is a symptom of predisposition to a much more serious disease, why is official medicine only concerned with relieving the pain?
Because, obviously, not having found the cause, it thinks it is correct to administer drugs that are able to reduce inflammation of the trigeminal nerve and thus bring relief to the person who obviously suffers from it. Then it is very easy when you have a headache to go to the pharmacy and throw down a pill. But we do not realize instead the enormous side effects we suffer when we take these kinds of drugs.
Here you mentioned medications, so I want to show you this video that talks about just the medications that are given, used to fight migraine. Let's watch it together.
What is certain, and we can say this also based on our published experiences, is that medication overuse, that is overuse of symptomatic medications, is still a factor that complicates, 1, because it promotes chronicity, 2, because it sometimes makes preventive therapies less effective, and 3, because it puts the patient in a logical of dealing with the enemy when it's there, but not in the logic that is often appropriate of therapy, and therefore also of an active role of the patient to collaborate with the physician in taking medication, a regularity, and also an expectation that has to be modulated over time. Not everything is right away, the drug that drives away my attack in half an hour, but that, yes, but also being able to deal with a treatment plan that is more organized, often more difficult for the physician, but especially for the patient, and therefore that of inappropriate use of medication is really a fundamental problem.
So, Mr. Panzironi, this was Dr. Domenico D'Amico telling us to consider several aspects before deciding to take a medication to combat migraine. The first among them is that these drugs can chronicize the disease.
But yes, of course, as long as we do not think of solving the problem from the cause, but only from the effects, it is obvious that all the drugs So these artificial molecules that we introduce somehow then bring some kind of resistance from our cells. So we will see the problem reappear again.
Here, the doctor also told us that it is wrong to take drugs that directly block migraine because this disincentivizes sufferers, obviously to prevention, but especially to go deep to find out what kind of pathology then hides.
This would certainly be agreeable if the doctor had talked about primary prevention, that is, stopping those things that lead to the onset of migraine. Instead, the doctor is actually referring to other drugs that have a broader spectrum action and are able to reduce the phenomenon of vasodilation of our cerebral microcirculation. So these are always drugs that, like all drugs, then will be useful for a while, but then they will no longer be effective.
So let's continue to talk about medications, but at this point I want to show you a video where we talk about the kinds of medications that are, let's say, made available to fight migraine, and so then we talk about them together. These types of medications are recommended, obviously, by official medicine. Let's look at it together.
The most widely used treatment against migraine is certainly those based on analgesics and anti-inflammatory drugs such as ibuprofen, which we find in the brands Moment, Brufen, paracetamol in tachypyrine and efferalgan, and also acetyl salicylic acid in aspirin. These over-the-counter drugs do not require a prescription. Then there are the drugs that are administered only under medical supervision and are of two types, ergotamines and triptans. Ergotamines, whose active ingredient is ergotamine, bind to serotonin receptors, inducing constriction of blood vessels in the brain. Triptan drugs act on serotonin receptors, mimicking their effect but with greater efficacy in reducing pain and constricting the vascular network.
The video talked about the various molecules that are used by modern pharmacology to counter migraine. So they range from simple analgesics to much more complex molecules that alter neurotransmitter function.
Certainly the most widely used drugs are those that inhibit the production of certain prostaglandins called COX-2. This is done by using precisely NSAID drugs that prevent these cells of the immune system from communicating with each other and thus from producing these inflammatory cytokines that then lead to inflammation. The problem is that if we do not interrupt the cause that induced the production of these prostaglandins, it is obvious that then, even if we have taken medication, maybe the next day we start again with more migraines.
These drugs are, however, even these then as we take them, they become useless because they become ineffective over time anyway.
Certainly because every molecule that is administered, the more we give, the more our immune system cells begin to become resistant. And this leads to the fact that we always have to increase the doses. And as the doses increase, the side effects of these drugs also increase.
Then there are these drugs, those other drugs, of course, that instead act just on the neurons by reducing the inflammatory action with the trigeminal nerve itself and getting a vasoconstriction of the cerebral circulatory system.
Yes, because once the fans are no longer working, one tries to solve the problem upstream. That is going to counteract the vasodilation phenomenon with drugs that are able to regulate receptors and thus lead precisely to constricting the vessel, or one goes to work with drugs that act on direct inflammation of the trigeminal nerve.
Here, but can these also become ineffective over time?
Whenever we go to overexpress a neurotransmitter receptor, we lead to resistance against this molecule. So initially these drugs may give relief, but then actually, if we do not interrupt the cause that induces the stimulation of these receptors, we are back to square one every time.
Before I continue, I wanted to show you a video because official medicine, Mr. Panzironi, seems to agree with you to match lifestyle with migraine and then to think about primary prevention. At this point, I'll show you the video and then I'd like to comment on it with you. Let's look at it.
Biofeedback is a side effect-free technique that can be used to treat a wide range of disorders and is a substitute for or complementary to drug treatment. This technique originated in the United States, where it is considered the therapy of choice for the treatment of pediatric headaches. As given the young age of the subjects, it is certainly preferable to taking medication. Thanks to the numerous studies that have since validated its efficacy, it quickly spread to Italy as well and is now active in the most advanced specialist centers. The technique makes use of a computerized equipment where, thanks to the use of surface sensors, it is possible to detect in real time some physiological reactions that are then sent back to the subject through the computer monitor. In this way, the person can become aware of his or her internal biological indices and learn to self-regulate them.
So you see, Panzironi, this new American technique, biofeedback, which is a verification of biological outcomes, empowers the patient to understand how stress acts on their metabolism.
Yes, this idea was developed in the United States, and then now this device is also used in migraine treatment. Actually, medicine has realized that there is a very close relationship between the excessive production of cortisol, the so-called stress hormone, and the occurrence of migraine.
So can this technique counteract the occurrence of migraine or not?
Yes, it can help counteract the occurrence of migraine because, as we said, cortisol, and we will also talk about it well later, is one of the triggers of migraine, but this can also go well with other relaxation techniques such as yoga. The problem is that the occurrence of migraine has different causes, especially those related to nutrition that affect the occurrence of this condition much more than stress. And we are going to make our audience understand this evening which foods induce the occurrence of migraine, and especially which ones can protect us from this condition, and then also natural supplementation that can help us overcome it.
Here then, I think it's only fair to delve into what are the different types of migraine. So we asked our Dr. Maria Immaculate Costanzo to explain them to us so that we can have everything well simplified and explained. Let's look at this together.
What is more commonly called a headache? Science calls it a headache, and headaches can be of two types. We have primary headaches and secondary headaches. Primary headaches, they are also the most common, are distinguished in turn into migraine with or without auras, musculotensive headache that originates from the cervical spine, cluster headache, which moreover is the least common. We also have secondary headaches, which are those that come from different pathologies. We can have headaches from brain pathologies, from drug abuse, until we get to psychiatric pathologies. We also have the so-called cranial neuralgia headaches.
So Dr. Costanzo, Mr. Panzironi explained to us that there are various types of headaches.
Yes, but this evening we are going to talk about the most prevalent ones, namely migraine and tension headache. It is, however, already anticipating them that those who follow the Life 120 diet see the problem of migraine disappear and see the phenomenon of tension headache greatly reduced.
Look, can you tell us in a very simple way the difference between these two types of headaches?
It is essential in the pathogenesis because in migraine we find an increase in the vascular volume of the cerebral vascular circuit, and that this then leads to inflammation of the trigeminal nerve, while tension headache is recognized because you have the start of the inflammation from the nerve. That precisely is below the cervical. So there is a crushing of this nerve, which is then the start of all the inflammation of the trigeminal.
So I would say, let's start in understanding what migraine is and what are the symptoms that let us know what type it is. So we always asked our Dr. Maria Immaculate Costanzo. Let's look at the service.
Certainly the most common headache is migraine. And it is a type of headache that more than others tends to become chronic. Usually migraine presents with pain that is definitely unilateral, very intense, throbbing, but sometimes the expression can be bilateral. It can last from 4 to 72 hours and is very often related by symptoms such as nausea, vomiting, irritability to light, but also to smells, sounds. There is blurred vision in some patients, paleness, sweating. This type of migraine may be preceded by signs, sensory symptoms. The patient reports flashes of light, vision of black dots in the visual field, tingling of the limbs, and in this case we call it migraine with aura.
So, the doctor told us about the most common form of headaches, namely migraine, and also how to recognize it.
Yes, migraine is a life companion for a lot of people, and unfortunately people think and believe that it is now almost natural to suffer from this pathology. In fact, it is a very intrusive companion because people who suffer from it find a substantial deterioration in the quality of life. In fact, when they have a migraine attack, they shut themselves in. They try to avoid what are sound stimuli, light stimuli, and even this pathology does not even allow you to sleep.
We have seen that medicine fights migraine with drugs that sometimes, unfortunately, also become ineffective, though.
Because unfortunately, as we said at the beginning of the episode, when we use these drugs, we are not acting on the cause, but only on the effect. So we are only going to try to correct this effect. Until then, that drug no longer works. Instead, we actually have to work on trying to understand what the triggers of migraine are and then avoid those triggers.
Here, about the triggers that you just mentioned, I found a video, obviously our editorial staff, that we would like to show you just about migraine triggers. Let's look at it together.
There are factors that are predictive, triggers in many subjects. As you said, it is true that each subject has such more specific factors. However, if we want to stay in general but scientific terms, very often the triggers are more obvious just in migraine forms. And what are the most common ones? Sometimes the dietary ones, either some particular foods or rather, how to say, the regular use of some foods, cheese, chocolate, alcohol. But more than that, it's more the food habit. That is, it's easier for a migraine attack to be triggered by fasting, skipping a meal, skipping breakfast regularly, or I'm used to having lunch and I don't do it for 1 or 2 days, or even the abundant meal, very rich and so on. So it's more a matter of regularity than food content. Or the change of weather. There are patients who are called meteoropathic, but they are meaning that wind, often even hot wind, sirocco, can trigger a migraine attack or a sudden thunderstorm, change of temperature or even pressure. And so they are all factors, some controllable, some not. Classically, another really well-known and strange factor is that of menstrual flows. That is the normal hormonal rhythms of a woman of childbearing age that have an influence.
So, Mr. Panzironi, this was Dr. Domenico D'Amico. He works at the Headache Center at the Carlo Besta Neurological Institute in Milan. And he told us, of course, about the triggers of migraine, such as nutrition, weather, and hormonal changes in women. So, apart from nutrition, which we will certainly go into more detail later, but what about the other two factors?
I think that when we now have a compromised situation of our cerebral blood circulation, or we have an overactivation of the trigeminal nerve, then any factor can lead to, can be menstrual flow, as we heard in the video. Actually, these are all factors subsequent to a pathological state that is present instead every day. A little bit, I give you the example of our witnesses who come here and tell us that for a lifetime they never managed to digest foods like peppers. They blame these foods. Actually, the problem was the digestive capacity of the stomach. After they solved this, they went back to eating all kinds of food safely, and it did not lead to any problem of digestive inability.
Then, speaking of foods, the doctor in the video also referred to certain types of foods, for example, chocolate, cheese, wine, which can still trigger migraine as well as even a skipped lunch.
I have to tell you that once again, official medicine has put innocent people in jail while leaving the real perpetrators free to racialize and do damage. In short,
here, however, it happens to many people that after eating these foods, they then have a migraine attack.
But certainly these foods have an amount of histamine that can lead to a migraine attack. But the problem is, again, we repeat, it's always the situation that person is in. In the case of people who get migraines after eating these foods, actually the problem is the production of endogenous histamine, that of our Th2 immune system, which is a system that is altered, but by foods other than the ones that were depicted in the video.
So, Mr. Panzironi, medicine, unfortunately, still has not found what are the triggers of migraine, such that we are told they are different from person to person. And the treatment also that, unfortunately, is in the high seas. I say that, of course, also in an ironic way. In this regard, I want to show you a very interesting video on migraine, and then I would like your comment. Let's see it together.
We have to be honest to the utmost, and we know, at least up to now, that there are no resolving drugs. That is, there is no therapy that can cure a primary headache because the pathogenetic mechanisms are really so complex and spread in various areas of the central nervous system that right now we don't have the key to unlock everything. However, it is clear that if we think in terms of, as we were saying before, helping the patient as a quality of life and disability, as a general impact of the disease, in most cases we succeed with drugs to have a change in a positive sense.
So you heard our Dr. D'Amico, he said there is no cure for migraine, only the possibility of relieving the symptoms.
Of course, this is business as usual because medicine, instead of worrying about finding the causes, only tries to solve the effects, when in fact it would be very simple to inquire. And they too would have discovered that there is already a cure for migraine.
So, you are saying that there are researchers who know the cure for migraine, but they don't want us to know.
You know me, you know that I don't think official medicine doesn't let us know these things for the purpose precisely of profiting from our disease. It is simply a matter of approach. For official medicine, disease is a normal thing. It is a problem of inability of our natural body. And so they try, perhaps with superior intelligence, to find drugs that are able to correct the mistake made by Mother Nature. Actually, all they would need to do is to inform themselves a little more, and they would realize that the real reason and unique above all of the occurrence of migraine lies precisely in our diet.
So you believe that there are some foods that must take the blame for migraines, and in your opinion, what are they?
They are the ones that are the basis of the Mediterranean diet. So we are talking about pasta, bread, pizza, rice, legumes, corn. These are the real culprits of the various types of migraines. Well, tonight we are going to talk about them and make it clear why. Also because, you know, I never make empty accusations.
And to that end, I know he has prepared a video, especially for us to make us understand what the metabolic action of migraine is like.
Migraine-induced pain depends on two factors: increased vessel size in the cerebral blood circulation and inflammation of the trigeminal nerve. Vessel dilation depends on a deficiency of the neurotransmitter serotonin and an excess of nitric oxide, a substance released by endothelial cells in blood vessels. Inflammation of the trigeminal nerve depends on the action of nitric oxide and interleukin-1 beta, which act on neuronal cells in the nerve, inducing the release of a neuropeptide called CGRP, calcitonin gene-related peptide. This neuropeptide induces the production of inflammatory cytokines called COX-2 and increased vasodilation of the blood-brain barrier, allowing access to immune system cells that will keep the inflammation active.
Let's look at it. So Panzironi, I realize that explaining the cascade of events that induce the headache is certainly very difficult. Then, as you have accustomed us badly, I must tell you in a simple way you will have to explain it. What do we want to start with?
Let's start with the concept that we have rules of our body. When we contravene these rules, pathologies appear. In this case, we do something that alters the rules of our brain.
So let's start right away with a question. How is it that in headaches we witness dilation of blood vessels?
Let's say that the dilation of various blood vessels is a normal aspect. Indeed, it protects our brain because whenever we have an increase in pressure, we witness on the other side. So in the microcirculation of the brain, an increase in basal activity, therefore the arteries present widened. This is precisely to avoid damage due to high blood pressure to those vessels that are instead much weaker, which are those of the brain.
So basically a mechanism that is actually supposed to protect our brain becomes a phenomenon that underlies headache.
Of course, as I was telling you, when we alter what are the rules, we turn something that should protect our brain instead into a pathology.
And what are the elements that instead accentuate vasodilation of the cerebral circulatory system?
As we saw in the video, we have on the one hand the increase in pressure that leads precisely to this basal increase in the microcirculation of the brain. We have a reduction in serotonin because, in fact, this neurotransmitter is a vasoconstrictor. So then we have another problem, which is the activation of this neuropeptide, which is CGRP, which is basically what is produced by the trigeminal nerve and also leads to vasodilation of our arteries.
About the trigeminal nerve that the video also talked about it, he wants us first of all to explain what it is.
It is a nerve that starts from the brainstem and then reaches the ophthalmic part, the maxillary and mandibular part. And so when we have inflammation, the pain also develops toward this direction.
What is it that inflames this nerve such that we get migraines?
It's just the cascade, let's say, of increased basal activity. So this basal size growth that leads to a production of nitric oxide, which is NO. And this acts just on the trigeminal nerve neurons that will then start to produce this neuropeptide. Then we also have the reduction, as we said, of serotonin leading to the production of glutamic acid, which acts both in stimulating the venous endothelium to release NO, and on the other hand, to superexcite the trigeminal neuron cells, increasing what is the effect of pain.
So it all starts anyway from this dilatory phenomenon?
Yes, it all starts precisely from this dilatory action towards the microcirculation of the brain that induces precisely, as we said, the direct production of this neuropeptide CGRP.
And so we basically have an increase in pain perception right up to where all the nerves of the trigeminal nerve go, all the branches, let's say.
Yes, we start from that, and then, of course, we act on an inflamed tissue, which is that of the brain, that was precisely induced by this vasodilation that leads to systemic inflammation of our brain tissue.
But then at this point, you have to explain to us what is the relationship between these foods in the Mediterranean diet and the occurrence of migraine triggers.
We have said many times during these broadcasts that the foods that are the basis of the Mediterranean diet, so we have bread, pasta, pizza, potatoes, rice and legumes, are actually very rich in sugar, up to 80%. It is actually sugar that acts in a whole series of phenomena that then induce the onset of migraine. I made a video just to try to explain these concepts that are different and somewhat complex.
So since you made it together with our editorial staff, I would say to our director to air it. Let's watch it together.
Vasodilation of the cerebral circulatory system is induced by excessive cortisol production, which reduces serotonin production and increases blood pressure by activating nitric oxide production. Excessive cortisol production depends on sugar-rich diet in response to glycemic declines and induced inflammation. Vasodilation is also induced by the excessive production of acidoaste caused by excess sugar in neurons. Another actor in vessel dilation is the neuropeptide CGRP, produced by trigeminal nerve neurons stimulated by interleukin-1 beta, which is also produced by mast cells during the phenomenon of gut dysbiosis induced by sugar-rich foods. Finally, vasodilation is also induced by histamine, a biogenic amine produced by the Th2 immune system, which is imbalanced by sugar-rich food.
So the video told us about many aspects involving sugar-rich foods, and so we talk about bread, pasta, pizza, potatoes, and so on.
Well, certainly for the simple fact that the main reason for the occurrence of migraine is precisely the superactivation of cortisol. Well, the diet is the main reason why we elevate this production, and it is due precisely to the fact that when we eat a nice plate of pasta, we first have a glycemic spike, and then insulin induces a glycemic drop. At that point, our body reacts by producing cortisol, and this cortisol serves precisely to raise our blood sugar. But at that point, we have hyperactivated this hormone that goes to act on neurotransmitters, thus altering their production and leading to a reduction in the production of serotonin, which instead will be replaced with norepinephrine.
Listen though, in simple words, when we eat a plate of pasta and then have a drop in energy or get sleepy, that is the time when serotonin is inactivated.
Certainly because cortisol acts precisely on our neurons, inhibiting the production of serotonin. To this, we then add the action that cortisol has in raising, let's say, so the pressure, and then inducing this phenomenon of production of that precisely allows the vasodilatation of our arteries.
Listen, can you explain more about the relationship between migraine and gut dysbiosis?
Of course, when we eat foods that are always the basis of the Mediterranean diet, we know that these sugars present induce the phenomenon of gut dysbiosis. This means that we have an alteration of the microbiota, and it will lead to the overproduction of immune system cells that we know of the gut to be over 70% of the total cells. Well, we produce a lot of mast cells, and mast cells are those immune system cells that produce interleukin beta. This interleukin is able to activate the production of cortisol on the one hand, and on the other hand stimulates precisely the trigeminal neurons to produce CGRP, which would be this neuropeptide.
So this interleukin beta-1 obviously, in addition to increasing cortisol, acts on the neuropeptide CGRP, right? I said it right. Therefore, inducing vasodilation of the whole lymphatic and venous part of our brain.
Yes, it brings this inflammation, leads to the increase of the NO, and then also causes hyperactivation of the immune system that is present within the brain cells.
But in addition to this vasodilation, does it also induce an opening of the blood-brain barrier?
Certainly, because our blood-brain barrier is nothing more than the walls of the arteries and veins that are part of our brain. So with vessel dilatation, we also have an opening of the junctions, and so this leads to immune system cells also entering our brain tissue, which in turn will begin to produce inflammatory cytokines and induce inflammation that will make migraines protract for several days or several hours.
Look in the video, they also talked about the role of histamine, about increasing the permeability of the blood-brain barrier.
Yes, histamine, especially in allergic people, also plays a key role because it is a dilator vessel. But this, we know, always depends on the alteration of our immune system, which is based precisely on the Th1 and Th2 balance. Well, the foods that are the basis of the Mediterranean diet induce the alteration of this balance, and then we start producing too many lymphocytes of the Th2 class, and then they will start producing histamine, then inducing the dilation of the arteries in our brain.
Look, you have explained to us many times that inflammation, or basically alteration of a tissue, does not bring anything good.
Certainly in our brain even more so, because it is a very delicate tissue. We know perfectly well that people who suffer from problems like headaches then actually are predisposing themselves to much more serious diseases like Alzheimer's control, dementia, but also the occurrence of stroke. And then there is also another phenomenon, that is the excessive production of peroxynitrite, which is nothing more than a molecule, a very oxidizing free radical that is formed precisely by the excess presence of NO combining with oxygen radicals produced by mitochondrial dysfunction within neurons. This formation of this peroxynitrite leads to systemic inflammation of the walls of our brain vessels, also inducing damage to the microcirculation.
Look, in addition to migraine, we also mentioned tension-type headache. What exactly is it?
It is well known by many people listening to us, all those who have experienced the phenomenon of whiplash.
So this headache no longer depends on nutrition, but on trauma.
Let's say that the start of this type of headache is just compressing the nerve that is below the cervical. So this can happen if we sleep in an incorrect position, if we make wrong movements. Actually, then from this start, we have a systemic inflammation that precisely affects the whole trigeminal nerve. And the effect of this inflammation can be greater or lesser depending on the nutrition we are doing, because the fact of predisposing precisely our brain to inflammation leads to that also. This tension headache can induce a stronger or lesser phenomenon depending precisely on how inflamed our brain is.
Look, Mr. Panzironi, take away a curiosity for me, because I have heard about the Sunday headache. Exactly what is it?
It's a migraine, and it's basically due to the fact that we vary our biorhythms. In fact, the brain doesn't know that it's Sunday, and so if we are used to sleeping until, I give an example, 6 o'clock in the morning, and then on Sunday we get up at 8 o'clock, this leads that at 6 o'clock in the morning we don't have the hyperactivation of cortisol. So on Sunday, when we are sleeping, we have a greater amount of sugar that ends up inside our neurons. This leads to the fact that we are not using this energy because we are sleeping, and therefore creates a buildup of acidic waste. We saw in the video that one of the reasons that lead to vasodilation of the arteries and veins in our brains is precisely the presence of too low a pH. And therefore this acidic waste that results from this production made in these 2 hours when we continue to sleep is the main reason for the occurrence of migraine.
Listen, Mr. Panzironi, I have a question, because you are very calmly and also very confidently, as well as simply explaining to us this evening the causes of migraine. But above all, you told us that it is possible to solve it with nutrition. What I wonder, is it possible that these things have to be told to us by a journalist like her, and not by a doctor who maybe has also done studies and works within headache centers for headaches?
The job of the journalist is to find the news, make it simple, and maybe then communicate it to the general public. That is what I am trying to do in these episodes. I have to tell you that this information is not available to everyone. You just have to know how to look for it. In fact, by the way, I found a doctor here in Italy who is smart, young, who is treating migraine with a certain kind of nutrition and not using drugs.
So I would say, see this video right away that our Adriano Panzironi brought for all our viewers.
This center, we are experimenting, for example, as a therapy with the ketogenic diet, which consists of inducing the body to produce acetone. Acetone has a protective mechanism in many neurological disorders. The thing we have observed is that actually this therapy, which is a diet therapy, you don't take drugs, you simply do a particular type of diet, induces the organism to cause this acetone to be produced, and it tends to be the case in the second majority of migraine and cluster headache patients that the disorder is reduced to such an extent that in some patients during this diet phase it disappears altogether.
So Piero Borbanti, this ketogenic diet, what does it consist of? What kind of effectiveness does it have?
It is a diet that basically excludes carbohydrates, and by doing so makes us produce, as my colleague De Lorenzo said, ketone bodies. It has recognized efficacy already in epilepsy and also in migraines, diseases in which the brain is hyperexcitable. Let me say one thing though. I would be a little bit careful, since we have a population that always listens to us, very attentive to DIY diets. The brain also wants its share of sugar. So for goodness sake, these diets done by a neurologist at a headache center are excellent for headaches.
Let's see. Then in this headache center, they are experimenting with the ketogenic diet with excellent results, Panzironi. That's very good news.
Yes, as I told you then, the truth is not so hard to find out. This doctor preferred not to use drugs, instead experimenting with a diet that is the ketogenic diet, getting excellent results. The doctor was telling us about this action of acetone, which is actually one of the ketone bodies that is produced when we do a low sugar diet, because now science has determined that these ketone bodies are able to to reduce neuronal inflammation because they work on the starter, the inflammasome, which is NLRP3, which is this enzyme that precisely starts and director of inflammation. In fact, the doctor could also have found that any diet with a low sugar content would have achieved exactly the same result.
Look, to make sure everyone understands the ketogenic diet, well, when we talk about the ketogenic diet, we are talking about a diet that is sugar-free but fat and protein-based.
Certainly very similar to the Life 120 diet, because those who follow the Life 120 diet actually introduce something like 50-60 grams of sugars per day. So in some ways it has to be considered a ketogenic diet. I should also point out that the real ketogenic diet is fasting. Only when we fast completely we have a very important production of ketone bodies, while in low sugar diets we have some of the production of ketone bodies, but still our body continues to use obviously sugars. The problem that then official medicine is always concerned about this amount of sugars that is needed by our brain, but we know perfectly well that the brain only uses 5 grams of sugar per hour, and that our body is also able to produce sugar from glycerol, which is one of the particles of fatty acids. It is able to produce from proteins that we do not use for plastic purposes. So actually the Mediterranean diet in its excessive amount of sugar is actually the real problem of the occurrence of migraine.
Yes, in fact, to me, even as I was watching the video, it was a little bit jarring that the doctor then made it clear that we still have to be careful about the amount of sugar because our brain needs it. So I was a little bit puzzled as well. Look, however, in addition to nutrition, can we find some solutions from supplementation?
Certainly, supplementation can be an important aspect. Consider that we talked throughout this episode about the role of cortisol. So supplementing things that reduce the production of this stress hormone can definitely be a viable option. I would absolutely say supplement melatonin before bedtime, because we know that it prevents cortisol production, so it inevitably reduces it during the night. But then there are substances that are able to inhibit cortisol production. In short, there are a lot of them in nature, Sisandra, Tribus terrestris, theanine, rose rhodiola, all natural extracts that inhibit the production of this hormone.
Together, we thank Adriano Panzironi, the author of the bestseller Living to 120.